Hi, we are going to go over Modern Dental Assisting Chapter 1 today. So, this chapter begins that a profession that is ignorant of its past experiences has lost a valuable asset because it has missed the best guide to its future, and that was said by B.W. Weinbrenner. So, we need to know what has happened in our past so that we can be guided to our future. In this chapter, it takes you through what has happened in dentistry's past so that we can understand what we can do to better our future for our patients. In the ancient beginnings, Egypt, when we look at that era, there are evidence that teeth were fastened together with gold. They took radiographs of mummified remains of pharaohs, and that shows indicators of gum disease. How it shows indicators of gum disease in those radiographs is that there's bone loss. So if you see bone loss or recessed bone in the radiographs, you know that there was periodontal disease. So they can see that in the evidence from these mummies from Egypt. In China, there was evidence of dentistry as long ago as 2000 BC. They see evidence of using a silver paste for fillings 1,000 years before the Western world did it. That silver paste that they were using 1,000 years ago is comparable to that silver paste that we use in amalgam fillings today. So they were starting to use amalgam like fillings thousands of years ago in China. So you need to know what the past is to see what the present holds and what the future holds for dentistry. In Greece, the practice of medicine and dentistry was based on the worship of priesthood. Dental hygiene using dentifrice and mouthwashes were used in Greece. So meaning that they were using toothbrush-like things in Greece. So they knew that it was important to get the debris off of the teeth and that would make a difference. And so dental hygiene was something that was practiced. They had writings that show descriptions of teeth formation and treatment of disease. And in Rome, they have extensive writings about dental treatment and medical texts. They were very skilled at restoring decayed or missing teeth, and they had a high regard for oral hygiene. So in Greece and Rome, you can see that they had regards for oral hygiene, and we know that they were using things like seawalks that were like twigs that were used to clean the teeth. These are some notable individuals in dentistry in the ancient period. So all of these individuals are people that you should take note of, and that you could look up these individuals and know that they have some bearing on the history, ancient history of dentistry. In the Middle Ages and the Renaissance, which is 500 to 1700, or the 5th to 17th century, dental health was important to the upper class. So oral health, white teeth, and fresh breath was very fashionable during this time. Barbers established two groups. So when they talk about barbers, they weren't only talking about people that were cutting hair. There were surgeons, barber surgeons for complex procedures. Or surgeons for complex procedures, and then barber surgeons for bleeding, tooth extraction, routine hygiene, and shaving. So two groups of barbers, one were surgeons, one were barber surgeons. So surgeons were the more complex, like medical procedures, and the barber surgeons were more like dental procedures and hygiene and shaving. Notable individuals in dentistry in the Renaissance period include these four individuals. So Leonardo da Vinci did a lot in the Renaissance, and you will see him listed throughout the chapter, as well as the other three of these gentlemen. In the 18th century, 1701 to 1800, diets were heavy with sugar, white tea, wine, and alcohol. And we know that sugars that are heavy, or diets that are heavy in sugars, especially refined sugars, cause decay. So tooth decay and barbaric dental care were common back in the 18th century because of those high containing sugar diets. They were going to have a lot of tooth decay. So if in this era that it was only fashionable for higher society to maintain oral hygiene practices, then lower society was going to have a lot more cavities and dental problems. So they're going to have a lot more decay and need for dental care. There was a limited formal education in dentistry at this time. So a lot of times to become a dentist, it wasn't schooling that these individuals were going through. They were going through an apprenticeship where they were learning on the job from a preceptor. So notable individuals in the 18th century are the five that are listed here. In the 19th century, 1801 to 1900, dentistry moves away from medicine achieving its own identity. So instead of it being clumped in with medical, dentistry finally becomes its own profession. The emphasis shifts from tooth extraction to tooth preservation. So instead of, oh, you have a toothache or you have a cavity, let's extract that tooth. Instead, we decided that it would be better to preserve these teeth, and they knew that it was better to try to restore the teeth. So for the advancements made in dentistry during this time, they had the first reclining dental chair. Before that, patients were sitting up for their dental treatments, and doctors were standing, and assistants, or ladies in waiting they were called, were standing for the treatment at this time. And so when they had the first reclining dental chair, doctors and ladies in waiting or assistants were able to sit down during treatment. The first dental college, Baltimore College of Dental Surgery, now the University of Maryland School of Dentistry, was opened during 1800s. The American Dental Association was also formed, which is called the ADA. And toothpaste in a tube was developed. Forms of toothpaste have been used for centuries. But toothpaste in an actual tube was developed in the 1800s. Notable individuals in dentistry in the 19th century are listed here. Note that Wilhelm Conrad Röntgen is listed in these individuals as he discovered radiation for x-rays for diagnosis in dental radiography. In the 20th century, improvements in healthcare and education came. So we learned a lot of new things about healthcare, dentistry, how to become educated in these areas. And there were a lot of advancements in dentistry from 1901 to 2000. A lot of those advancements that we're still using today. So we're using nylon and electric toothbrushes. So we use nylon bristled toothbrushes is what we recommend to our patients. Or we recommend electric toothbrushes. They're both effective as long as they're used properly. So with a nylon or a manual toothbrush, we're going to want our patients to hold the toothbrush at a 45-degree angle to the gum line. With an electric toothbrush, we're going to want to allow the toothbrush to do the work for them and just set it on the surface of the tooth that it's cleaning and allow it to sit there and let the toothbrush do the work. They also standardized dental operating procedures in the 20th century. They started using Novocaine for pain. So Novocaine was a local anesthetic that they used for pain in dental procedures in the 20th century in the 1900s. Novocaine is no longer used as a general anesthetic for dentistry, but there are several derivatives of Novocaine that are used. So we use carbocaine, septicaine, xylocaine, mevicaine. There are lots of other canes that we use, but we just don't use Novocaine itself because there are better drugs out there to use. And that's what happens over time, is that a drug is found or a procedure is found or invented, and then we refine it and find a better way to do it or a better drug to use. Also, x-rays were found for diagnosis. So now we can use x-rays to diagnose and treat patients. So we can find the problem, the root of the problem. We can find decay. We can find teeth that are extracted or broken. We can look and see impacted teeth and growth patterns. Fluoridation of public water supplies is also in the 1900s. So we know that fluoride in minimal amounts is good for the teeth. So when they add fluoride to the public water supply, it has cut decay rates in several areas. So the amount of fluoride in the water, if a patient asks you, it's about 1 part per million is what the safe ratio of fluoride is. So what is 1 part per million? 1 part per million is about a drop of fluoride in a bathtub full of water. That's what it equals to. So in the 19th century, there was also an addition of chairside assistants. They were called ladies in waiting. Edmund Kells is the first dentist credited with ladies in waiting. Dental sealants were also invented. With dental sealants, you can apply these clear plastic coatings to the occlusal and sublingual or buccal surfaces of teeth, of newly erupted teeth, and that will, if they are applied correctly, they are 100% effective against preventing dental decay. Dental implants, 95% effective, and they are for replacement of missing teeth. They can also be used for the abutments of bridges or implant dentures, and are very successful. We are using lasers to treat gum disease. Lasers can be used for many different things and are very interesting. So you can use a laser if the doctor has it, say if a patient has a cold sore. As the cold sore, if it's first forming, it can be hit with the laser and it will stop the cold sore in its tracks so they don't get the bigger ulcer that they normally would get, or blister, I'm sorry. And the laser can also treat aphthous ulcers, which are canker sores, and stop them in their tracks right where they're at so they don't get worse and turn into the bigger ulcers. So in the 20th century, there was also the rise of specialization. So there are 9 specialties in dentistry. And when we first started out with dentistry, we just had general dentistry. Now we have all of these specialties, including maxillofacial surgery, conservative dentistry, prosthetic dentistry, pediatric dentistry. All of our specialties were brought to light in the 1900s. So notable individuals in the 20th century, Dr. Green Vardaman Black, or G.V. Black, who you will hear a lot about throughout your program, is known as the grand old man of dentistry. So he's done a lot for dentistry and created and written a lot of different things for dentistry, along with the other gentlemen who are listed in this slide. In the 21st century, 2001 through today, the majority of the United States has the opportunity to access dental care. There are still some rural communities that do have limited access to dental care, in which we are trying to work on that now. Some of the advances are digital dentistry. So we are taking more digital x-rays and using more digital electronic health records. We're using surgical telescopes, controlled oral anesthesia, tissue engineering, and tooth replacement therapy. Our goals are to have improved public health, continued commitment to science-based practice, aggressive approach to health promotion, and increased collaboration among health professionals. Dentistry is lagged behind in terms of diversity. And why? There's a lack of awareness of oral health careers. We are trying to spread awareness for the oral health careers. The high cost of education sometimes can get in the way of that, and they are working on promoting more ways to help people pay for that education. Benefits of increased diversity are improved patient care and satisfaction, increased access to oral health care, and reduced oral health disparities. So there are gender diversity in dentistry. Women were not recruited or not generally accepted into dental schools in the 18th and 19th centuries. Now women represent 51% of dental school graduates in active dental practices. So the women are up and coming in dentistry and are the majority actually, instead of the minority. These are a list of some notable women in dentistry that they do go over in your chapter. And in the early years of the ADA, people of ethnic diversity were denied admission. As of 2020, 70% of practicing dentists in the US are still white. Ongoing effort to increase ethnic and racial diversity in the profession through recruitment, education, and training. This is a list of notable diverse individuals in dentistry, and they do go over some of these individuals in your chapter. Allied health are individuals who use scientific principles and evidence-based practice for the evaluation and treatment of disease, promotion of disease prevention and wellness, application of administration and management skills to support healthcare. So this is a description of allied dental health. For the history of dental assisting, back in 1885, like I said earlier, Edmund Kells employed the first dental assistants, and they call it a lady in attendance. This made it respectable for women to visit the dentist alone, because in that time, women were not in the presence of other men without a chaperone. So with these ladies in waiting or ladies in attendance, they made it acceptable for women to be able to go to the dentist because there was another woman there. In 1924, establishment of the American Dental Assistants Association by Juliet A. Southard. And in 1948, a certifying board of the ADAA, the American Dental Assisting National Board, was established. So these are four of the individuals who are notable in dental assisting. So Hazel Torres and Anne Erlock actually are the people who wrote the Modern Dental Assisting book. Dental hygienists used to be called dental nurses, and they provided a prophylaxis treatment or a dental cleaning in the late 19th century. Irene Newman was the first dental hygienist. And the first school for dental hygienists was developed in 1913 by Alfred Fons. The American Dental Hygiene Association was established in 1923. And that is the end of chapter 1. Thank you.